I was talking in a session that was organised by Cancer Research UK, looking at how to prevent cancers. And my focus is tobacco addiction and trying to prevent people from smoking. And I was talking about standardised packaging of tobacco packs, which has been introduced in this country this year. And I was talking about the research and regulatory barriers and political barriers to introducing standardised packaging. The difficulty is with standardised packaging that you can't do randomised controlled trials because it's a population level intervention aimed at reaching an awful lot of people. And the tobacco industry has promoted its products very, very widely in the past, and we know that tobacco promotion causes people to take up smoking and prevents people from stopping smoking. And they've been prohibited from using lots of different channels. And when you prohibit them from using one channel, they put a lot of money and energy into another. And more recently, they've been focusing on the tobacco pack and making it very attractive and alluring. So a few years ago, we drew together all the evidence that had been done from a number of different studies. So we found that standardised packaging is less attractive to children than branded packs. We also found that with standardised packaging, the health warnings stand out more. And health warnings are important because they inform consumers about how dangerous smoking is. And we also found that standardised packaging causes smokers to realise that there is no difference in harm across different tobacco packs. So with branded packaging, consumers are misled into thinking that some packs are more harmful than others. So, for example, if you see a red pack of cigarettes, you think they're likely to be more harmful than white packs, whereas in fact all cigarettes are deadly. So standardised packaging helps to reinforce the messages about how dangerous smoking is. Australia introduced standardised packaging at the end of 2012. Now, at the same time as introducing standardised packaging, they also enhanced the health warnings. And then a year later, they had high price rises. So it's quite difficult to unpick the impact of standardised packaging. But the Australian government produced a report last year which indicated that, in fact, the introduction of standardised packaging had made branded packs, had got rid of branded packs, so it had been implemented well. And they suggested that it had had a decrease on smoking prevalence. This is something that we're studying separately and independently. We're carrying out a Cochrane review of packaging, which will be available next year. I think that as well as having a good research base, you need the evidence, but there are also political barriers to implementing some of these tobacco control measures. And there are also regulatory barriers because governments are trying to cut regulation. So, and we also had legal challenges from the tobacco industry. So when you are introducing measures which are going to affect the profitability of the tobacco industry, they do react to these and tend to take governments to court.